Welcome to another segment of our Partner Spotlight series, brought to you by the members of the Regional Chronic Disease Collaborative. The Regional Chronic Disease Collaborative members work together combining their resources and expertise to help prevent the development and progression of chronic disease across our region. Our Partner Spotlight initiative is to help share innovative approaches being used throughout our region to improve population health. This is Mia Taylor, a family nurse practitioner from Queen's Health System in Hawaii. Today, she's going to share with us how they used community health workers as part of their care team. Welcome, Mia. Thank you.
Thank you so much, Patty. Really appreciate your invite to join and share some of our experiences today.
Sure. So why don't you share with us what project you had or what problem you were trying to solve?
Yeah. So I am actually fortunate enough to be part of the Queen's Physician Network, and we have a interdisciplinary team that helps support patients as they transition from hospital to home, as well as in the community. And this is really focused on our highest risk, highest needs patients. Parts of this team include RNs, social workers, dietitian, pharmacists, social work associates that support the licensed team. And then the most recent addition over the past couple of years have been what we call our patient navigators or community health workers. So we've really rounded out the team by adding these lay navigators to help support the licensed team.
Great. And what were you hoping to accomplish with these new team members?
So, we have many programs that are targeted towards our highest risk, highest needs populations, the usual programs, things like, diabetes programs, blood pressure control, addressing social determinants of health. But we all know that no matter how many programs we develop, it's all about patient engagement. And so there were really two things we were trying to accomplish. One was improving patient engagement. Second, we were really hoping to make sure that everybody was working at top of license. So as the RNs and the social workers were developing the plan of care for the patient, they could then hand off to the other team members to execute on that plan, which allowed us to really increase our caseload.
Wow, that's great. So what results did you experience from this program?
Yeah, good question. It's really been amazing. So there's really been two areas where I've seen significant growth. One is in our engagement rate. And I'm going to give an example. So if a patient has uncontrolled hypertension, uncontrolled diabetes, and we outreach that patient on behalf of the providers to say, hey, it looks like you could really benefit from maybe some disease-specific education. We could have an RN meet with you, a social worker, if there's some, financial issues with picking up meds, things like that. And the patient may say, no, I'm not interested in that. And, what we've learned is that if we say, what can we help you with? Oftentimes, there are things that we don't think of that patients need help with. Like, I'm the primary caregiver for my mother with dementia. I can't make it to my doctor's appointments. And then really starting that conversation, or, I have food insecurity and I have no way to pick up healthy foods. That's where we can bring in a navigator and say, let's help you with that. Build that engagement, and then the navigators are able to bring in the social workers or the RNs as needed, or a dietitian or a pharmacist. So it really has helped significantly with engagement. The other part that is really great is that patients will tell community health workers, navigators, things that they would never tell me as a nurse or a social worker or a pharmacist, because they don't want to be scolded, right? And so the navigators come in, the community health workers come in with no agenda. Their questions are, how can I help you? Is there anything that I can do to make things better? And those are the types of things that patients really respond to. So we have navigators coming back to us saying, hey, there's some issues here with this patient, and this is what they shared with me. So it really allows us to get a much better picture of what all the social drivers or social determinants of health are for that particular patient and their caregivers, and how we can best help.
Well, that sounds wonderful. I know you've been working on this for a while and you've had a huge impact in your communities, but what part of this program has made you feel most proud?
Yeah, I think really truly it's the patients, their satisfaction, what the stories they tell. We send out satisfaction surveys, and they are so excited about our program. And in fact, a lot of times, we'll help them with something, we discharge them from the program, they'll call us back to say, hey, I'm having this issue or this need. So it's really that collaboration. But also the other thing is that it has really helped us tremendously with allowing all of our licensed staff to work at top of license. So there's a lot of professional satisfaction from our licensed professionals. So we have very little turnover. And then the last thing that is really important in our milieu here in Hawaii, and I'm guessing nationwide, is it's really helped with our workforce shortage. So I can bring on these community health workers or navigators to augment my team. And by doing that, because we have such a shortage of nurses and social workers and pharmacists, I've been able to really increase our panel size instead of having to limit it, because of the fact that I can bring these navigators and community health workers in to help augment the team.
Wonderful. That sounds great. So what advice would you have for other organizations thinking of doing this?
Okay. Yeah. Good question, Patty. I think for me, the biggest hurdle that I really needed to overcome was building that business case for my leadership of why I would want to add lay navigators to this licensed team, to that traditional model of care coordination team. So it's really building that business case, and how I did that is really, again, talking about workforce shortage, talking about everyone working at top of license, looking at the financials. I can bring on 2 navigators for the cost of 1 social worker, or 2.5 FTEs of navigator for the cost of an RN. So it really does make financial sense, which is important to health systems. But I think the other big piece is, figuring out how best to utilize these navigators or community health workers in your team. And so one of the suggestions that I have for health systems or for community partners who are interested in adding navigators is to bring them in as students and have them do their practicum with your team. And that way you can really get a feel of how receptive is the team to working with a navigator and how best to utilize them before you actually post the position and hire. That has been very rewarding. We've done that in several areas within the health system, just to get them acclimated to the teams, and that's worked well.
Great. Thank you so much for spending time with us today, and good luck with your program.
Okay, thank you so much.
If you are interested in sharing your innovative approach, please contact one of these Mountain Pacific representatives. Thank you so much.